Good evening, sir. Good evening.
Yeah, I think, can you able to hear me?
Yes, sir. Yes, sir.
I think that there is a problem with the export line, so she's going to present only audio.
Yeah.
Ma'am, Kalyani ma'am? Yes, you can speak.
Yes, sir. Okay, sir. Thank you.
Still, I invite Dr. Kalyani Kenneth ma'am for the topic Reboot Your Emotional Health. She's close to me. We were working in Rajiv Gandhi National Institute. She's a professor of psychology. She's having vast experience in the field. Ma'am, I invite you to share your experience on that. I think.
Thank you. Good evening and welcome you all to this Zoom session on disturbances.
இல்ல நீங்க can proceed ma'am. நீங்க பேசலாம் கேக்குது. We can able to hear you. Please proceed.
Okay. Thank you. Reboot emotional health. Opportunity to thank Dr. Suresh Kumar, who's been my friend and colleague, for giving me this opportunity to share with all of you a thought of my own reboot during this lockdown period. I am Dr. Kalyani Kenneth, the Department of Counselling Psychology, Madras School of Social Work. Emotional health is all about the way we think and we feel and the ability to cope with difficult things in life. If something happens and we feel low emotionally, getting back on track can be difficult. When you have a cut, you do first aid, you put a bandage or take antibiotics to treat the infection. If something happens, we feel low emotionally, and getting back on track can be difficult. We are all same and have lot of emotional problems. We are not aware of where are we
denotes relaxed, happy, content, friendly behavior. While negative emotional health denotes upset, sad, withdrawn, angry, isolated, agitated, and so on. Now, the main theme of the session on emotional health is to know how to practice emotional first aid. First step is to pay attention to your emotional pain. How do we identify or recognize our emotional distress or pain? It's quite natural.
It's quite natural.
All of us get into emotional pain. But when it is sustained for a longer period, then it becomes a concern and you need to take action. So first step in practicing emotional first aid is to identify your emotions and take action. The second step is to redirect your gut reaction. By nature, psychological wounds tend to undergo emotional spirals. To break them, we need to learn to ignore. How is it possible to ignore? Telling is quite might be difficult. First, think about preparation and planning. How to cope with the distress or how to help in resolving the issues. This will reduce feeling the helplessness and enhance future success. As we know, we are now undergoing a major crisis of being in lockdown situation, where most of us by now would have identified some of our emotional pain. And in order to cope with the situation, we need to redirect, we need to prepare ourselves, we need to plan ourselves to reduce our feeling of helplessness and enhance our future success. Next step is to observe and defend your self-esteem. Self-esteem is an emotional immune system that buffers you from emotional pain and strengthens your emotional resilience. When you have a high self-esteem, it enables you to fight with the emotional pain. When you are having a low self-esteem, it will be difficult for you to come back to a normal state. Hence, rebooting your emotional health by enhancing your self-esteem to a more positive self-esteem level would help you cope better. Next is to replace negative thoughts with positive distraction. Now, what are these negative thoughts? It's again quite natural for human beings to undergo a spiral or a connectivity in our thoughts. One negative thought could lead to another, and another. This could be happening in a vicious manner, repeated for a longer period, which can harm your emotional health. Hence, the best way to disrupt your unhealthy thoughts is to distract yourself by engaging in tasks that require concentration. For example, playing chess, doing gardening work, completing a puzzle work, finding the cat or find 10 differences, and lot more is available. Next step is to find meaning in loss. Yes, we are all in a stage where we are rooted with or bombarded with lots of negative thoughts which lead to loss. We don't know for sure what would be the condition after the lockdown is over. We are all only having thoughts which leads us to loss. We might lose our job. We might not be able to earn much. We will not be able to support our family and lot more. Loss is a part of our life, but it can scare us and keep us from moving forward. If we don't treat it, the emotional wound it creates, we would be suffering from emotional disability. Loss could be in any form: spouses, job, money, game, etc. But think of what you might have gained from the loss. Now, we all know that we have been following a disciplined manner of functioning till date. As and when the lockdown was declared, we were happy going, staying at home, taking it in a positive manner, relaxing, and trying to cope with the situation. But as the days kept extending, all of us have lost our hope, have lost our faith. We have started bringing in the fear of failure or loss. But think of what might have gained from this loss. Studies indicate that unemployment will increase in the near future. But at the same time, it indicates that entrepreneurship will also increase. It means people will find meaning in life. They will be able to utilize their entrepreneurial skills for their livelihood and not be dependent on others. Till date, we were not able to identify the strength that we possess. We were just following the leader. We never looked within us to enhance our skills to cope with the stressful situation. Next is to understand what techniques would be more appropriate for emotional wounds to work for you. As we know that all of us have physical, psychological, and social issues. Physical issues, for example, an headache, could be resolved through immediate medication. Just as you would identify which pain relievers on the shelf work best for you, the same goes for building emotional resilience. First, pay attention to yourself and see how you can deal with common emotional wounds. When you were in an emotional state, did you wave it off? Did you get really upset and recover quickly? Or did you get upset and recover slowly, etc.? All the treatment procedures and techniques lie within an individual's ability to think, feel, and act. So, you can even look into various outcomes of the lockdown, which has positive emotion. Due to the lockdown and social distancing, interaction and bonding among families have gone up, which most of us have been longing, but were not in a position to take certain steps because we were committed to our work. The work-life balance was lost, but now the lockdown has given us a golden opportunity to interact and bond with our families. Second, the positive emotion is sharing of family chores have increased. Men and women both need to work these days and also need to support each other in bringing up the family. So sharing of family chores have increased because of the lockdown and social distancing, which is a positive. Lack of to alcohol led habitual drinkers stop drinking. Many alcohol de-addiction centers have been working strenuously to rehabilitate and cope with the patients, alcoholic patients. With more than 50% of success, they were unable to treat some of the alcoholics. But the very fact of lockdown has shown a drastic result of alcoholics have stopped drinking, which is again a positive emotion. Yes, opportunities for telecounseling has increased. No doubt, just my session, you would have heard to another session on telecounseling. Days have gone where people had stigma relating to counseling, even identifying their own emotions and accepting a disability or disturbance was considered to be abnormal. But now days have come where opportunities for telecounseling has increased. I would like to add on telling that there has been a number of telecalls received by my own colleagues during this lockdown period relating to various emotional issues, starting from isolation, depression, getting angry, unable to cope, failure, and so on. Alcoholics were also one among them. And lot of marital issues and domestic violence also increased. The students or the adolescents were facing lot of self-esteem issues. They were facing lot of fears of failure. They are facing fear of uncertainty and lot more. So the opportunities for telecounseling has increased because of the lockdown and social distancing. Next, people have started to identify and recognize their emotional state and take measures to maintain their emotional health. Yes, I'm happy that through this Zoom session, we are able to connect with each other and we are able to share our thoughts and experiences through which we have come, and hoping that this would be of great help to anybody in the society is a great boon, where people have started to identify and recognize their emotional state. You would have seen sessions like in television, they show, what is that?
Debate. Right? Yes.
So there are people who come, experts who come and sit and readily accepting or listening to the questions raised by the public relating to various issues. This itself shows how people have started recognizing their emotional state. Each one you would have heard starting from a small cough and cold to that of old age, diabetic, and hypertension. People have started raising questions and clarifying their doubts through the Vivadameda sessions on TV channels, which itself shows that people have now started recognizing and identifying their emotional state. Yes, these are the ways how we can think and solve our emotional disabilities and try to see how we can cope with the emotional disability. I would like to end with a positive note, saying that necessity is the father of invention, and we can together overcome this difficult phase of our life happily with positive emotional health. Stay safe, stay at home, and stay emotionally healthy. Thanks for your patience listening. Thank you.
So I will unmute other calls. They may ask you questions. You can respond to them, ma'am, and then 1 minute.
Okay.
Yes, ma'am. Yes, Dr. Meena.
Ma'am, Kalyani ma'am, can you hear me?
Your audio is not.
Hello.
Can you disconnect the mic and then speak?
Yeah. Yes. Hello.
என்னது?
Maybe I'll do that.
Yes, yes. So anybody else? You can put it your question in chat. Hello?
Hello?
Waiting others.
Yes, sir. Yes.
க்ளோஸ் பண்ணிடு. போட்டோ வராதபடி க்ளோஸ் பண்ணு.
Dr. Post.
Hello.
Yes.
கேக்குதுங்களா சார்? Hello.
Not audible.
Okay, I'll type.
Okay, you can put it in the chart. The chart will be there. No, I can.
That's what, sir. I'll do that.
Ma'am, yeah. Before that, I would like to ask one question, ma'am. What is the common emotional problem right now, ma'am, due to that lockdown?
What are the common emotional problems?
Yes, ma'am. Yes, ma'am.
Yeah, emotional problems are isolation,
Yes, ma'am.
depression,
Okay.
feeling of insecurity,
Yes, ma'am.
fear of failure are some of the emotional problems that people are facing due to lockdown. Hello?
Yes, ma'am. Yes, ma'am.
You want
Ma'am, there is one more question from Dr. Veena. And she would
Yeah.
like to know that how to deal with emotional burnout.
emotional burnout?
Yes, ma'am.
Okay. Emotional burnout could be due to various reasons. Either you are overstressed or you are overburdened with any kind of work could lead to burnout. Now, the ways you would be dealing with emotional burnout is first is to identify your emotions. Then you need to think of ways to cope with it, like relaxation, engaging yourself in activities which will be of great use or providing happiness to you, and you will be satisfied by doing it, or listening to any form of music, engaging in any kind of strenuous job so that you engage yourself and concentrate in that and tend to relax by doing the activity could help you in coping with emotional burnout. Yes, sir?
Yes, ma'am. I think she's satisfied. She's thumbs up. Okay. Dear participant, would you like to know any other clarifications, or would you like to add a few more points and then rebooting your emotional health? You can. Your points are welcome here.
I didn't get this, sir. Can you repeat it?
Ma'am, not is for you, ma'am. It is for the audience, ma'am.
Okay, audience. Okay,
Yes.
fine. Yeah.
Dear all, if you have any points you would like to add on for this presentation, you can add on, or would you like to hear from the resource person? You can put your questions in the chat box. I can able to convey the message to resource person. Yes, Mr. Haran?
Yes, sir.
Yeah, can you? Haran? I think he was joined little later, so due to that, I think he's not able to connect. I think I will give it.
Hello, sir. Do you hear me, sir?
Yeah, yes, I can able to hear you. Please.
Yes, sir.
Yeah.
Sir, regarding this emotional health,
Yeah.
so what is the main thing I have to ask is, what about the turning negative emotions into positive emotions, sir? Because in this lockdown, as they are being inside they are facing somehow the negative emotions too much also. So is there possibilities to convert negative emotions to positive, sir?
Ma'am, his question is how to convert negative emotions into positive emotions, because we are having a lot of negative emotions this period.
Yeah.
Yeah, this is the
Yeah.
There
question.
are no options to vent out in this time.
Converting your negative emotions to positive emotions, first thing is you need to disrupt or distract yourself from the negative emotion, right? As I said, negative emotions are quite common, and it is very natural for people during disaster to have negative thoughts or emotions, right? The best way is to disrupt the unhealthy or the negative thoughts is to engage in activities which will put you in strenuous tasks. Like, for example, I told you if you're going to play chess, right? Your mind needs to be totally involved in the process of playing the chess game, right? So there are chances for the negative thoughts to be replaced with the positive thought of engaging in chess game, right? So it is actually very difficult. Saying maybe it's quite easy, just do this, but when you tend to practice, it becomes quite difficult. And I would in fact enforce that it is not one-time aim that can replace your negative thoughts. You need to replace your negative thoughts by strengthening or repeatedly doing these tasks by either playing chess or doing some kind of gardening or involving yourself in activity which will require your concentration. You need to be more highly concentrated. People talk about relaxation and meditation and all. I'm sure it is not that easy to replace negative thoughts, because when you are in a calm and cool mind, the inner mind starts working more faster than usual. So chances of getting into negative thoughts or continuous cycle of negative thoughts or a chain of negative thoughts becomes very inevitable. So it is better you involve yourself in some form of strenuous job or creativity. If you can identify certain strengths in you which you have not been utilizing it due to various other reasons, enhance or strengthen those skills so that you get satisfaction. When you get satisfaction, that makes you reinforce and makes you feel satisfied, and you tend to repeat it again and again. So in order to replace your negative thoughts with that of positive, you need to first get the negative thoughts distracted with positive, healthy activities, which is more suitable for you or as an individual based upon your strength and ability.
Ma'am,
Am I clear? Is that okay?
yes, ma'am, we can able to get your point, and we are having less than a minute. And thank you, ma'am, for the wonderful presentation. I think
It is helpful.
even we
Thank
had
you
a-
so much, sir.
yeah, even we had a technical issues, and then with the alternative, we had a wonderful session. All the participants are showing their hands, and then they are writing in the chat box also. Thank you, ma'am, for your nice input.
Thank you.
Thank you so much.
Thank you all for your support. We'll meet again tomorrow. Thank you all. Thank you.
Thank you. Thank you.
Thank you. Thank you very much.